Hi, Doc.
Morning, Chris. Morning, Sabrina.
Good morning. Doc, I had to do a double take because I
Can you
saw.
hear me?
I can hear you fine. Good morning.
Yeah.
I had to do a double take because I saw somewhere in your Facebook you had posted something like you actually agree with the governor on something.
I know. Isn't that
I
incredible?
mean, we had to stop the press like, oh, whoa, 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 guys. Everything just came to a screeching halt.
Yeah.
I mean, hell, the temperature in hell, it must be negative 10 degrees right now.
I don't disagree with the government on everything, but I noticed that we were very concerned about the hospitalization rates and all that. But then, if you recall, very recently, 10 days ago, I think, just the governor wrote a letter August 8 to the Center for Disease Control. And within that letter, if you read it carefully, it's a very detailed letter on how Guam is prepared and how Guam is actually a low risk. And with that regards, it's around the first page. It says that we're also prepared for any surge in the hospitalization with 83 COVID designated hospital beds, and they have the capacity to expand that into 200 or more and 75 ventilators. Now, when I first read that letter, I go, how are we going to staff that, right? How are we going to staff that? But I'm not here to always argue with the governor, so I'm going to agree with what the governor's letter has already said, and that's an official letter with the governor's seal that's sent to the Centers for Disease Control.
Right.
So if we are so prepared for the surge, then why are we in P Core 1? So that is the real question. Now, it's the messages, Chris, and I've always said this, that we have to be consistent with the public and with the federal government, and also with our tourism industry as well. We have to be very consistent. And I know the Chamber of Commerce has came out voicing their concerns regarding the same inconsistencies coming out of Guadeloupe.
Right.
And, with the letter itself is very indicative of what we're trying to say, is that the messages coming out are inconsistent messages, and we got to be consistent. So I may have said it in a sarcastic way that I agree with it, with that letter to the CDC. Then again, you have to think about it. I was one of the first ones to say that you can have 2,000 beds. You can prepare for 2,000 beds, but you just don't have the staffing.
Right.
Yeah.
We brought that up with Fernando Estevez yesterday. But let me ask you this, though. You work at GMH. You've been there. Do they really have 83 COVID designated hospital beds?
Not that I know of personally, because I don't go into the area of the ICU. Thank God that I don't have critical ill patients there. And ER, I do visit ER, and I do trust the staff there. Dr. Jolene Agin is very good. Dr. Andrew Taylor is very good. And I think they're handling the surge, or whatever you may call it, in a very professional manner. But I think what we need to also think about is that we need to take the letter very seriously. That's a letter that's given out to the public, and is given to an agency, a Center for Disease Control, where we are arguing with them regarding the level of warning that they put out for all travel. So if the governor is saying that we do have 83 COVID beds and can expand that even more, then I tend to believe her. But then again, where's his staff is coming from? But what's surprising is the letter came out, and I'm sure the Physicians Advisory Group has reviewed it. So obviously they didn't say anything, so I'm sure that they agree with it as well. But then again, we have our own chat groups. We talk offline, and we talk about certain issues that the public may not be able to hear.
Yeah.
As you know, Chris, I'm very vocal about these things because I want the message to be clear. I want the message to be consistent. Are we prepared for the surge? This is what the letter says, coming out straight from Guadeloupe.
Right.
If we're not, then don't send out that letter. Retract it and issue something that's more consistent with what we're doing.
Yeah.
That's my main point when I say I agree with the governor in that letter. But, sarcastically, I do agree in a way that we are prepared. But like I said,
I didn't catch the sarcasm, Doc. I thought you
Well,
really
it's hard to
agree-
catch the
Yeah.
sarcasm in a
Hey, I learned it
WhatsApp,
from you, Chris.
Yeah. But I mean, Doc, really what this is, the CDC, I mean, a lot of people, and I'm sure Adelup feels this way, they feel like they took a shot at us, and the governor had to clap back. And of course, she's not going to clap back and say, we don't have enough ICU beds, and the COVID's so bad here that we're opening a whole new COVID ward at the hospital. And right now at GMH, they're trying to create more space for COVID patients because we're just seeing this crazy surge, and they're putting patients in the closet. They got 2 patients in the elevator that's not working. They're going to go put this guy here in the stairway. I mean, yeah, so of course the governor
We're
is...
going to order Blue Med tents.
Right. Of course the governor is going to be like, we are doing great, just, almost...
No, but in the press conference she held last week, she said that we are a hotspot.
Yeah. So I know, yeah, now we're a hotspot, but at the time that she wrote the letter, it was more of a, defensive posture.
Yeah, but still at the time when she wrote the letter, we were seeing that
Chris,
increase in cases.
Right. Yeah.
What's in the letter regarding the hotspot, cold spot, to me doesn't really matter.
Right.
What matters to me is the fact that she put in there in that particular letter that we are also prepared for any surge in hospitalization. 83 COVID designated hospital beds with a capacity to increase 200 or more and 75 ventilator. That's besides whether or not, your hot spot or low spot,
Right,
whatever,
right.
medium spot, whatever you want to call it. I disagree with those formulas anyway.
Right.
But
Well,
the fact is that the letter says that you have enough beds, you're ready for the surge. So those are
It could
irrespective of
mean,
what you call
how do we know that this doesn't mean that we have the 83 COVID designated hospital beds between GMH, between Naval Hospital, because, Lillian said that the governor is in communications with Admiral Minoni, that should we reach a certain trigger point, he's standing by to assist, right? Or maybe there's hospital beds at GRMC. Do you think that's maybe what she meant?
Well, then that's okay. I don't care where the bed's coming from. The fact is we have 83 COVID designated beds. But Guam, as we know, you have a designated COVID hospital. So I'm assuming that the 83 bed is at GMH.
Yeah.
Now, if the 83 beds, let's say 40 is at GMH, 40 at GRMC, and then 23 is at a Naval Hospital, that's okay too. The fact is, the letter says that we're prepared for the surge. Right. That's the main point I was getting through.
Yeah.
But regarding purchasing $1 million for this 10th bed that you're mentioning, did I hear that correctly?
I didn't say $1 million. I'm not sure how much it is, but according to Lillian Posadas, when there was an ops meeting 2 days ago, and the governor instructed Guam Homeland Security Office of Civil Defense to purchase these blue medical tents. And, I had asked Fernando, why are we just doing this now? Shouldn't we have done this way back when we had all these projections that we were going to be experiencing this surge in September? I mean, we had this John Hopkins projections and all of this. Yeah. So I'm just kind of curious, why are we just doing this now?
Well, that's a question for them to answer. But, we were supposed to be preparing for over the last 3-4 months. That was the...
But Doc, I mean, when we talk to these people, what it seems like happened was, we had the doomsday projection, and when it became clear that wasn't going to happen, I feel like everyone just walked off the field. I mean, that's what I feel like. And, we heard from Sergeant Estevez, it might not have been the case because he said that they were doing things, they continue to be doing things to prep for this. But when we have the hospital administrator on talking about how she's got to create a whole new ward and
COVID care unit 4.
Right. It just, I don't.
And
I mean,
move
the governor
like the
can
telemetry
write,
ward,
right.
And
I mean, the governor can write whatever she wants to write. But when we talk to the people who are actually in these positions at the hospital,
but you remember,
it doesn't. I don't feel as confident.
Well, you remember the SNU that they created, right? Before
yeah,
they shut it down because they couldn't fill it.
Well, they have the SNU.
Those are all coming down.
It's called the SIF,
right. So,
the SIF SNU. They don't even have the chillers yet. They're supposed to have them this week, according to Lillian. That's what they're hoping for, so that they can open up that facility. But all the people that were being treated at the SNU have been moved to Catholic Social Services with no contract.
Yeah. The other question, too, is somebody messaged me, do we believe in God? Do we believe in God? That's a good question, isn't it? If we do believe in God, then we need to allow the churches to practice their faith and go back to what they believe in. We need to respect the faith of people. Science is one thing, but then the faith there is another. So you have to ask the question is that, do we believe in God? And if we do, then we need to look at the services of the church and allow that to be an essential service and practice the 3 W's. Like I said, mask, wear a mask, wash your hands, and watch your distance. And I think if you can do all those three things, you should prevent yourself from getting COVID. But going back to the messages, what the adult will be saying, again, they have to be consistent with what they do. Right. You know, now they're going to go back and they're going to say, well, let's go back to the drawing board. Let's draw down that board. 83 bed. No, we don't have 83. Do we have 50? You know, do we have, what do we have so that we can make the public understand that this is a serious situation, right. That the surge at GMH is really bad. We have 14 now, but we have 83 beds. We said we had 83 beds, but wait a minute, we're a critical position now. We're 14. So what is it? Is it 14 or do we have 20 beds? We have 83 beds as noted in the letter. Those questions I raised myself. It's like, God, this is so inconsistent. I really want to believe, Chris, Sabrina, I really want to support the governor and what they're doing. And I do, but I want the message to be consistent. I want the message to be consistent so that we can believe it. And I want it to be transparent. And I've always emphasized transparency. You know, when you have these PAG, Physician Advisory Board meetings that don't want to allow any other doctor to chime in or zoom into these conferences, it doesn't make us feel any better. So of course, we're going to question that. And those messages written in official letters to the CDC that we have 83 COVID beds, but now we're shaking in our booties because we have 14 in the hospital and how sick are they? And we have 75 ventilators, but do we have 75 staffing to manage all those? You know, those questions are inconsistencies. We cannot be drawing up letters for political reasons as well. We can't say, well, we don't want to be level 3, so let's write a letter reassuring them that we can do this. But on the other hand, we're telling our own people in Guam that we can't do this because we have overwhelming surge at GMH or at GRMC or the Navy. You know, we have to have consistent messages so that we can believe a government that's transparent is a government that we can trust. A government that's non-transparent is a government that we have to question, right?
Right.
Right on. Right on,
All right, Doc.
Yeah.
Thank you so much.
Thanks for joining us.
Well, one thing for sure is that you have been consistent in calling for consistency. So thank you.
And
next
I don't
time,
have any financial interest in this. And I don't sell things. I don't go for RFP contracts. I don't say, hey.
Boom.
Yeah. Doc, next time you say
way,
you agree with the governor, I'm not going to believe you, though.
I study and I am board certified, okay? So let's just put that out there. I do have my credentials, too, okay?
Right.
By the way, congratulations. I know that you're celebrating, how many years is it?
Oh, 24 years on Guam. You know, I wish I could have a big party, invite everybody over to the new clinic. But that's not happening. So next year, 25th. I think that's the diamond anniversary, 25th? Yeah, I think it is. So it's going to be a big year next year. So, you know,
right
hopefully that we can all celebrate the 25th year for women and children. Not just women and children, but the dads, the families. You know, my practice, it's actually a family practice, you know, because a baby is, you know, come from the mom and dad, and then there's grandparents, the great-grandparents, there's families, there's uncles and
Ninos and Ninas. Yeah,
about,
we got you. Right on, Dr. Shieh. Congrats, and we'll catch up with you again in a few days.
Yeah, 25 years. Maybe we can go to 30 years. We'll see.
Okay, Doc. Thank you. Well, you can, okay? Because there's one thing we do pretty good here on Guam. It's making babies.
Yeah, and remember now, I predicted there's a surge in babies, right? Coming up 2021. We'll see.
I'm still waiting for the first baby named COVID.
Oh, no.
COVIDilin. You guys would. You would.
Covidicus.
That's yeah. I like COVIDlin.
COVID-Lin?
COVID-Lin with a dash, right?
Let's get people to put up their suggestions on this live stream.
Put them in your comments. What's your best COVID baby name? Even Surge is that's kind of a cool name, right?
Yeah, that's pretty cool.
Surge.
Well, on Guam, it would probably be COVID.
COVID? Yeah. Okay. 7:16, we're going live with the Guam Behavioral Health and Wellness Center right after this break on the link. The brief.